Okay, welcome back. We're now going to look at the lateral line. Now, the lateral line tension is very dynamic. The lateral line modulates movement left and right, but it's coordinated with the front and back line. And both these lines are always in relationship with each other. We're sort of arbitrarily, in some sense, just focusing on this line, but it's a crucial line to put a lot of technique on. And it sets up some interesting patterns. The sternocleidomastoid is actually on the front line and the lateral line. And my premise is if you have problems with that muscle in the neck, you probably also have line problems. So let's unpack the lateral line for a second. The hub of the lateral line is considered the greater trochanter. And it takes in your gluteal fascia, your iliotibial tract. It moves down the perineals, around the malleolus to the fifth metatarsal. It also then connects up with the head of the first metatarsal and is instrumental in lifting that transverse arch. The main motion pattern at the ankle is mediated in eversion inversion, and that's important. And of course, then there is some side flexion that we work with. So this part is pretty straightforward. We would assess this line up and down. We would also begin to bring our first rolling assessment in, and then we would look up and down and put a twist on. And if this was just going to work with a simple static, just like we showed in the back line and that we demonstrated in the front line, we would put a certain amount of pressure, pick a direction, or pressure direction, several directions, with compression, and hold it until we felt a glide. But I want to continue with the assessment. So regarding assessment then, is we're going to lift the arm and put our hand perpendicular on the rib cage. We're going to keep one hand here, and actually we're going to lengthen the knees out slightly. Now what that does is bring just a tad of instability for your client. But this is important because this is the first time we're going to use rolling motion to go ahead and assess ease and bind. Now, let's do some fundamentals because this will set up some of the other techniques that I show you. If I roll forward, her head will need to sort of turn forward. If I roll back, she must roll with me with the head because that keeps a neutral spine. If she holds her head there and I roll back, it puts a tension and a twist that we both can feel immediately. So whenever you're using movement in side-lying position, you must allow the head to translate with the motion to keep a neutral spine. So what we're doing now is like we did with the shift techniques, we're applying lateral line, which is lateral application on the side of the body, but from a side-lying position, which is the optimal position in my mind to work the lateral line. Now, so we're checking roll, and what we can find out as we roll her is it easier rolling back or is it easier rolling forward? And we can feel with Sue it's much better back. That's your first assessment. Your second assessment is how much elevation of the shoulder do we get when we use our hands on the serratus anterior, on the rib cage, as we move up and down. And then we also could sort of try to roll the shoulder forward and back. Now that is at the level of first restriction. You'll see when I do these assessments, whatever line I'm on, it's always the level of first restriction. That's where superficial fascial tension is, and that's what we're clearing first before we would open up any of the other deeper areas, either subdermal, deep fascia, deeper muscle. So, up and down. We're checking this. Now we can feel. Now when we're checking, the third dimension is roll is one, checking motion. There's a secondary that's part of an arm line but really works with the lateral line is how far the arm goes up into this position. And for Sue, it's not too bad. It's covering her ear. Often we can see arms sitting here. It is meant to go all the way back, probably another 10 degrees on Sue. And what that's indicative of is not just the lateral line, but the scapular translation around the thorax. We'll get to that later. We come back into position of assessment. We felt the bind on the long arm. We've checked up and down. We are starting to roll. The last assessment now is twist or rotation. So what we do with that is we check a twist one way and we check a twist another. So you can either use the roll with the twist or the twist with the roll. Let me say that again. You can roll with the twist or you can twist with the roll. Each will have a little different ease-bind relationship. But nonetheless, let's check the roll first and then the twist. And this twist is in ease, this is bind. As I hold the ease twist, I can roll her again. Because what we're doing is we're finding the positional platform for the static compression. And once we find it, it's like setting the table. You're just waiting for people to come sit and eat. So you've got this all set up. You've got the compressions right. You've got your twist. You've got your perfect spot on the roll. And the rest is, with a breath, the body does the rest. And here we go. That's what happens. It starts to change. Next thing you know, that moves. Next thing you know, she turns and we rock and roll. We bring the hand up. And now that's showing us where we really need to work. That will bring us into a whole set of levering, which we'll talk about another component. But because it's Sue's birthday, I'm going to do this release. So Sue, hold on. Let me give the instruction. Sue, you're just going to pull down toward, release, let it go. Got it? Let it go. There's the arm overhead. That was a little out of the line, as they say. And as we roll forward, she can begin to feel the difference. Now, if we just apply a static, we could just do our usual down, check a direction, put a twist on, put the pressure down, and there's the release. As we get into deeper aspects of the line, we can begin to use some of our friction and active movements to work the groups that are under and associated with the ITB, in this particular, the vastus lateralis. I'm going to leave that alone for a second because we're just looking at a fundamental foundation course with line work. But now you can see she's moving in all directions. You can see her roll is much better. And this helps really begin any of the QL work I would do, is to open this line up. Now, the next segment I'll show you in a moment.